If you're struggling with full mouth reconstruction, then this is probably why. You think that you may need to do MSc, diploma or certificate courses in order to do full mouth reconstruction. Maybe you've done those courses, and we all have done courses where we learned something and we came back and we never implemented that because you feel that there was no system in place, you did not feel confident implementing that on your own, and more importantly, you did not have mentoring. We know for sure that when you are learning complex skills such as full mouth reconstruction, you do need a mentor by your side in order to implement those skills very, very quickly. If you have, all the time in the world, maybe you can take 10-15 years and learn by yourself. But when I teach full mouth reconstruction to my diploma courses, most of my delegates end up doing full mouth reconstruction within 3 to 6 months because we meet every other week in order to discuss cases. We have full mentoring in every step of the way when they're doing full mouth reconstruction. Now, maybe you know all this, but you're worried about litigation and you're worried about failure. So all these cases, all these reasons may be why you're not being able to do full mouth reconstruction. But the real why is not because you don't understand how to do full mouth reconstruction, you don't have the skills. You can Google it, you can YouTube it, and you will be able to find the protocol to do full mouth reconstruction. It's not the lack of knowledge, but it's the clear, structured system to help you implement that along with the mentoring. So, many clinicians I meet, they all tell me that, I know how to do full mouth reconstruction, but there is something is holding me back. I'm not being able to implement that. And if you have the correct recipe, if you have the correct framework, you too can do this kind of full mouth reconstruction, which was done by one of my mentees. And that's what I do. I've been teaching full mouth reconstruction for over a decade. I teach at King's College University, University College London, and different university. And as I said, I also run a diploma in full mouth reconstruction program where I only take 9 delegates per cohort. And my goal is to really help you treat this type of patient and take them through the journey and be able to give you such an amazing result. Now, what's your next goal? You may have a goal that you want to do something more than single tooth dentistry. You may want to be able to do quadrant dentistry effectively. You maybe want to plan full mouth reconstruction or complex cases very, very simply and predictably. You may want to able to try and treat larger cases because you might think you're stuck with the smaller cases. Or you want to maybe work less and earn more. We all know that dentistry can be quite, you can get burnout quite easily. So if you work a little bit less, then you will be able to sustain that, clinical exposure for longer. So learning full mouth reconstruction will help you achieve all of these goals. And for that reason, I've created this free FMR coaching series, which will give you some basics, fundamentals of full mouth reconstruction. It's divided into 6 modules. Module 1, I'm going to show you how to do case selection for FMR via webinar, recorded webinar. So you'll have the webinar included in the email. Each modules are supplied via email. So email number 1, which is module number 1, we'll discuss case discussion. Module number 2, I'm going to show you occlusion in full mouth reconstruction and give you some resources. In module 3, we're going to discuss about diagnostic, which is some of the most misunderstood concept when it comes to doing full mouth reconstruction. I'll give you a sheet which we can fill out and you can send it to technician when you're doing full mouth reconstruction. Then I'm going to give you access to my podcast where I've discussed 3 steps of full mouth reconstruction in detail, so you can listen to it and you understand what is that protocol or that framework. In number 5, I'm going to discuss about digital versus analog full mouth reconstruction. Now, since past 3 years, almost 99% of my full mouth reconstruction are digital. That's where we are moving, but there are very subtle changes with occlusion and with other things, and I will discuss about that. And number 6, I'm going to give you some tips on maintaining your work, because one thing to do full mouth reconstruction, but if patient can destroy those teeth, which are much harder enamel, they will be able to destroy your restoration. So you need to make sure you protect those restoration. Once you've gone through all that, I'm then going to run a free webinar where I'm going to show you some of the mistakes I've made and some of my delegates made, so that you can learn from our mistakes, and I'll be able to answer question whatever you have from these 6 modules, whatever you learn. So yes, this is a free module, free coaching series, but don't treat it like a free coaching series. This is worth more than £600, whatever knowledge you're going to get in there. So make sure that you absorb every single knowledge and turn up to the webinar and ask me any question you have, and I'm here to help. So I hope you enjoy this series, and I look forward to seeing you during the webinar.